They tell you to eat one every day. Doctors recommend them. Cardiologists approve them. Nutritionists place them near the top of almost every list of foods that protect the heart, the muscles, and the energy of people over 60. Cheap, convenient, natural. For decades, the banana has been treated as one of the safest foods a person can eat. But here is what almost nobody is telling you. After 60, the way most people eat bananas every single day may be silently worsening blood sugar, straining the kidneys, disrupting sleep, and triggering fatigue, without a single obvious warning sign. Not because the banana is dangerous, but because 7 specific mistakes, so common they feel completely invisible, can turn this trusted daily habit into a hidden metabolic risk. If you eat bananas regularly and you are over 60, the next few minutes may change the way you think about something you assumed was entirely safe. Before we continue, subscribe to this channel right now if you have not already. Every week we bring you exactly this kind of content. The information your doctor rarely has time to explain, delivered clearly and honestly. Now let me tell you about Margaret. Margaret is 68 years old. She walks 3 mornings a week, watches her portions, and has eaten a banana almost every day for years. Before her morning walk, blended into a smoothie with mango and orange juice, sometimes at night right before bed, because she had heard it helps with sleep and muscle cramps. She believed completely that bananas were one of the healthiest choices she could make. Then the symptoms arrived. Slowly, the way they always do after 60. Fatigue that did not match how much she had done. Cramps that woke her at 2 in the morning. Blood sugar numbers her doctor described as unpredictable. Mornings where she felt dizzy before finishing her first cup of coffee. Nothing that screamed emergency. Just a quiet, persistent feeling that something was slightly off. When she described her full daily routine in detail, the answer surprised her. It was not something she was ignoring. It was something she was doing, every day, with complete confidence that it was helping her. 3 silent mistakes, all of them involving the banana she trusted most. I have spent more than 3 decades working with adults over 60, focusing specifically on how the aging body processes food differently than it did at 40. And what I see is not people making reckless choices. It is people making careful, well-intentioned choices based on information that does not account for how profoundly the body changes with age. After 60, the kidneys filter more slowly. The insulin response becomes less efficient. The muscles store glucose less effectively, so carbohydrates hit the bloodstream faster and with less buffer. And the body's ability to regulate potassium, one of the things bananas are most famous for, becomes significantly more sensitive to excess. The banana did not change. Your body did. That invisible shift is exactly why these 7 mistakes matter so much more now. We go from number 7 to number 1, because the last mistake is the one that concerns me most as a doctor, and I want you to hear it completely. Let us begin. Mistake number 7. And this one happens in almost every kitchen, every single morning. You are choosing bananas that are too ripe. Most people do this because ripe bananas taste better. But here is what that choice does inside your body. When a banana is lightly yellow with small green areas at the tips, most of its carbohydrates exist as resistant starch, a form that moves slowly through digestion, does not spike blood sugar quickly, and behaves more like fiber than sugar. As the banana ripens and those brown spots appear, that resistant starch converts almost entirely into simple sugars that absorb rapidly into the bloodstream. For a body over 60, where insulin sensitivity has already declined, that daily spike lands differently. It hits faster, the body takes longer to recover, and the repeated pattern, day after day, can quietly worsen metabolic stability in ways that never announce themselves clearly. The fix is one small visual cue. Choose bananas that are yellow, with a little green still visible at the tips. That difference in appearance is a significant difference in how your body processes every bite. Mistake number 6. This one surprises almost everyone. You are eating bananas late at night. It feels harmless, light, natural, easy to digest. But when you eat a banana before bed, the natural sugars enter your system exactly when your body's metabolic rate is slowing for the night. For many people over 60 with some degree of gastric sensitivity, this quietly worsens reflux and fragments sleep without an obvious cause. There is also the glucose curve, a small blood sugar rise at 10 at night, followed by a drop at 2 in the morning, is one of the most under-recognized causes of middle-of-the-night waking in older adults. The body reads that drop as a mild stress signal. Cortisol rises slightly. The person wakes, does not know why, and cannot fall back asleep. If this sounds familiar, your evening banana may be worth reconsidering. Mistake number 5. This one is about combinations, not the banana itself. You are pairing your banana with sugary breakfast foods, banana with sweetened granola, banana alongside flavored cereal, banana with pancakes and maple syrup. Each of those foods already carries a significant glycemic load. Adding a ripe banana on top creates a breakfast that sends blood sugar rising sharply in the first 30 minutes. Stacking carbohydrate on carbohydrate at a moment when the insulin system has the least flexibility to respond. Think of a cup that is already nearly full. Pour more into it. After 60, that overflow happens more easily and recovers more slowly. It surfaces as mid-morning fatigue, unexpected hunger before lunch, or energy that collapses before noon. Small signals most people attribute to age. They are not always signs of aging. Sometimes they are signs of breakfast. I want to pause here. The mistakes we are covering today are part of a larger pattern. How the aging body responds to food as a system, not just individual choices. I have put together a complete program that addresses this entire system. Timing, combinations, and the daily habits that silently accelerate these problems. You can find it through the link in the description or the pinned comment. If you are watching on television, scan the QR code visible on screen right now. The patterns we are discussing build over months and years. Act now. Let us keep going. Mistake number 4. And this is the one that genuinely shocks people because it involves something most adults over 60 consider a symbol of healthy living. You are drinking banana smoothies every single morning. Think about what a typical smoothie contains. 2 bananas, a handful of mango, a cup of orange juice, maybe a spoonful of honey. Combined in a blender and consumed in under 5 minutes, they deliver a concentrated carbohydrate load that absorbs far faster than solid food, because blending breaks apart the fibrous structure that would normally slow sugar release. When you eat a whole banana, fiber slows its sugars into the bloodstream. When you blend it, that structure is destroyed. Multiply that by 2 bananas, add mango and juice, and the smoothie you believe is protecting you is delivering a glucose spike that a body over 60 handles with considerable strain. Repeated daily, that pattern places quiet pressure on the liver and the body's ability to regulate blood sugar. It does not cause a crisis overnight. It contributes, invisibly, to the kind of metabolic drift that shows up in lab results as numbers trending in the wrong direction for years. Margaret's smoothie was one of her 3 silent mistakes. 4 years of mornings, convinced it was the foundation of her healthy routine. If you want to keep smoothies, the adjustment is simple. Use half a banana. Add ground flaxseed or chia seeds to restore fiber. Replace juice with water or unsweetened almond milk. Add a small protein source. Those additions do not eliminate the smoothie. They slow it down, and slowing it down is exactly what the body over 60 needs. Mistake number 3. This one affects people trying to start the day with energy, and does the opposite. You are eating bananas on an empty stomach. After 60, eating a banana as the very first thing in the morning, with no fat, no protein, nothing to slow absorption, creates a rapid rise in blood sugar followed by a drop the body struggles to manage. That drop surfaces as mild dizziness, fatigue arriving in a wave 30 minutes after eating, and cravings for something heavy before you have finished your morning routine. For people managing prediabetes or taking medications that influence blood sugar, that cycle is more disruptive than most realize. The solution is not to stop eating bananas in the morning, it is to never eat them alone. Pair your banana with a small amount of protein. 2 eggs, a tablespoon of almond butter, a handful of unsalted nuts. That combination slows sugar absorption significantly. The energy arrives gradually, lasts longer, and the crash simply does not happen. I want to pause here. Understanding these mistakes is the first step, but having a structured plan, one that tells you exactly what to eat, when, and how to combine foods to protect your blood sugar and energy after 60, is what actually changes outcomes. That plan exists. Find it through the link in the description or the pinned comment below. If you are watching on television, the QR code on your screen right now takes you there directly. You have already invested this time. Take the next step now. 2 mistakes remain. And the last one is the one I want every person over 60 to hear. Mistake number 2. This one requires careful attention because it affects millions of older adults quietly, often without a formal diagnosis. You are eating too many bananas when your kidneys are not functioning at full capacity. Kidney function declines gradually with age, quietly as part of normal biology. Many adults over 60 have some degree of reduced kidney filtration and have never been told, because the reduction is mild enough that it does not yet meet the threshold for a clinical diagnosis. The connection to bananas is direct. The kidneys filter excess potassium from the blood. A medium banana contains roughly 400 milligrams of potassium. For kidneys at full capacity, that is handled without difficulty. For kidneys operating at reduced efficiency, far more common after 60 than most people realize, the daily accumulation of potassium from bananas, combined with potassium from other foods, can gradually push blood levels higher than the body can safely manage. Elevated potassium does not announce itself the way chest pain does. It arrives as unexplained muscle weakness, a fatigue that feels heavier than ordinary tiredness. In more significant cases, irregular heartbeat, symptoms most people attribute to aging, which is exactly what makes this mistake so difficult to identify without a direct conversation with a doctor and a simple blood test. This is not a reason to eliminate bananas. It is a reason to ask your physician one specific question about how much potassium is appropriate for your individual kidney function. Mistake number 1. I have been building toward this since the beginning, because this is the mistake that concerns me most as a doctor. You are eating bananas daily while taking certain blood pressure or heart medications without knowing the interaction. ACE inhibitors, lisinopril, ramipril, enalapril, among the most widely prescribed drugs for blood pressure and heart failure, reduce the kidney's ability to excrete potassium. Potassium-sparing diuretics, such as spironolactone, work by a similar mechanism. When someone taking any of these medications also eats 1, 2, or 3 bananas every day, the potassium from those bananas has fewer pathways out of the body than it normally would. Over time, potassium can accumulate to levels that are no longer safe. The medical term is hyperkalemia. The consequences can include muscle weakness, irregular heartbeat, and in serious cases, cardiac events requiring emergency intervention. I have seen this pattern cause real harm in patients who were doing everything else right. The most important thing I can tell you is that this is entirely preventable, not by stopping bananas, but by having one direct conversation with your doctor. Ask, given the medications I take, how much potassium is safe for me daily? Bring your banana habit into that conversation. That single question may matter more than anything else you do for your cardiovascular health this year. If you take blood pressure medication, heart medication, or any medication for kidney or fluid balance, and you eat bananas regularly, do not wait to have that conversation. If this video gave you something valuable, I want to ask for something small in return. Press the like button right now, subscribe to this channel if you have not already, and leave a comment below. Which of these 7 mistakes surprised you most? I read every single one. Margaret made 3 adjustments, not 7, 3. She switched to lightly yellow bananas with green tips. She moved her banana to mid-morning, paired with 2 eggs. She replaced her daily smoothie with a smaller version built around half a banana, ground flaxseed, plain yogurt, and water. No dramatic overhaul, no expensive protocol. Just 3 quiet corrections to a habit she had practiced for years without questioning. 2 months later, her energy was more consistent through the afternoon. The cramps that had been waking her at 2 in the morning became infrequent, then stopped. Her blood sugar numbers began trending in a more stable direction. She slept through the night. She felt, in her own words, like herself again. Not a younger version, not a transformed version, but the version she recognized. Steady, clear, present. That is what correcting silent mistakes does. It does not reverse the clock. It removes the invisible friction that has been quietly working against you. Friction so subtle that most people absorb it into their understanding of what aging feels like, never suspecting that some of it was optional. Let us bring all 7 together. Bananas that are too ripe deliver a blood sugar spike your body over 60 cannot absorb smoothly. Choose them slightly underripe. Bananas at night disrupt digestion and create a glucose drop that fragments sleep. Move them to daytime. Bananas paired with sugary breakfast foods stack carbohydrate on carbohydrate at the worst moment. Change what surrounds them. Banana smoothies destroy the fiber that makes the fruit valuable and deliver sugars all at once. Slow them down with protein and seeds. Bananas on an empty stomach create a rise and fall cycle that leaves you shakier than if you had not eaten. Pair them with protein. Bananas in excess with reduced kidney function allow potassium to accumulate past safety. Know your numbers. And bananas combined with certain blood pressure medications can create a dangerous potassium interaction that most people never mention to their doctor. Mention it. None of these corrections requires giving up bananas. Every one of them requires understanding that after 60, the same foods consumed in the same ways do not produce the same results they once did. That is not a limitation. That is information. And information, applied with care, is how you protect the energy, the independence, and the quality of life you have worked your entire life to reach. The banana was never the problem. The way it was being used after 60, that was the problem. And now you know. If someone in your life is over 60 and eats bananas every day, a parent, a sibling, a friend, a partner, share this video with them directly. Not because it will alarm them, but because this is the kind of specific, practical information most people never receive. The next video on this channel continues this conversation. The foods, the habits, and the invisible patterns that change after 60 in ways nobody explains clearly. Subscribe so you do not miss it. The people who need this most are often the ones who never go looking for it. Take care of yourself, and take care of the people around you who trust you enough to listen.